Good morning, sir.
Good morning.
I'm Eugenia Sympli, second year medical student. Today I will be doing your lungs and chest examination. Is that okay with you?
Yes.
Okay, may I know your name and age, please?
My name is and my age is 21 years.
Okay, so first of all, I will wash my hands. Sir, can I have your permission to take off your shirt? Okay. So first, I will inspect the patient thorax for the shape movement of the chest wall, symmetry, and also for any bony deformities. Next, for the patient respiratory rate. Okay, the respiratory rate of the patient is 19 beats per minute. And now for retraction of muscle. Okay. There is a retraction of the muscle of the neck. Sir, can you show me your finger? Okay. The color of the nail is pinkish and there is no sign of cyanosis. Now a palpation of the sternal notch. This is to check for the position of a trachea. The trachea lie in the midline. And now I will be doing the posterior examination of a posterior chest. First, I will inspect the shape, movement, deformities or asymmetry in a chest expansion, abnormal retraction and impaired respiratory movement. Okay. Now for palpation, I will palpate to check if there is any tender areas. Sir, do you feel any pain?
No.
Okay. So there is no area of pain located and also there is no lesion or bruises suspected for rib fractures. And now for chest expansion, I will place my thumb at the level of the tent rib. So, please breathe in. Breathe out. Breathe in. Breathe out. Okay. The chest expansion is symmetry and this is also called as a lung excursion. Now for ductal fremitus, I will use the ulnar sides of my hand. Sir, can you please cross your hand? Sir, can you see 99?
99, 99, 99, 99.
I can feel the vibration on both sides of my hand. Next is the percussion. There is no abnormal dullness heard and the sound that I hear is resonance, which is often heard on normal lungs. Now for diaphragmatic excursion. So can you please breathe in, breathe out, hold. Breathe in. Hold. diaphragmatic expression of the patient is 4 centimeter, which is normal. And now for auscultation. Sir, can you please cough one or twice? Here I'll be listening for the vesicular sound, bronchial sound, and bronchovesicular sound and adventitious sound. So please breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Okay, the sound I heard for vesicular sound is soft and low pitch, and for bronchial sound it is loud and high pitch, and for the bronchovesicular it is intermediate pitch and intensity. And now for transmitted voice sound, first I'll be doing the echophony. So can you please say E?
E, 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 E.
The sound that I heard is muffled long E sound. And next is the bronchophony. So can you please say 99?
99, 99, 99, 99.
And here the sound I heard is muffled and indistinctly. And next and lastly is for the whisper pectoriloquy. So can you whisper 99? Okay. The sound I heard is faintly and indistinctly. Now I'll be doing the examination of anterior chest. First, I'll inspect the shape of the patient's chest and movement of the chest wall. Also, I will look for any deformities or asymmetry of the thorax and abnormal retraction. Okay. Now for palpation, I will palpate the anterior chest wall for identification of tender areas and assessment of bruises, sinus tract or other changes skin. Okay, next for the chest expansion, now I will place my thumb on the costal margin of the patient and my hands along the lateral rib cage. Okay, so can you breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Next for tactile perimeters, I'll be using the ball surface of my hand. Perimeters is usually decreased or absent over the pericardium. Now for percussion. there is no area of abnormal heart. And now also for liver dullness and gastric temperature. And the last one is auscultation. So breathe in, breathe out, 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 breathe in. Sir, can you please say 99?
99, 99, 99, 99.
Okay, with that, I'm done with the lungs and chest examination. Thank you.